My name is Stacie Lindsey. I'm the CEO of the Cholangiocarcinoma Foundation. We support patients who are navigating a journey from a diagnosis of cholangiocarcinoma, and we run a pretty extensive research network of clinicians and scientists globally, encouraging them to collaborate on research that they could do together that will impact patients. There are other organizations who raise money, but there aren't other organizations that have a support network for the patients that are funding significant research fellowships. Anyone who's funding cholangiocarcinoma research, we're working with them. For cholangiocarcinoma, we don't know how it works. We don't know why people get it. We know some of the risk factors. We don't know all of the risk factors. So we don't have a lot of data and information that we need so that we could move into broader areas of research. We really need some of the basic research resources. And you need those so that companies who are interested in rare disease have the resources that they need. They need to have materials to test their drugs and see if they'll work. So we focus on those areas. One of the first questions patients ask is, where can I find a specialist? And not just an oncologist, but our patients specifically, they need to see a surgeon, they need to see a rad-onc, so being able to see the referral networks inside their institutions and also outside the institutions is also critical, because we can see if they're having a multidisciplinary tumor board that's looking at each patient, which is critical in a rare cancer diagnosis. We set the algorithm of what should a patient be looking for. And then we just put that out front on a map. So a patient is just going to say, who should I see? Well, I'm in Idaho, so click. Or, I'm in Minneapolis, click. And then they can see a list of, so it's very simple. It's a very simple lift for the patients, but we're always making sure that we're adjusting the algorithms to make sure that no matter what state they are in, there's somebody that they can see who has some experience. If the patients have access to aggregate de-identified data, if they know what they're looking at as a baseline, then they can get the care that they need. So if they know that patients do better who are seen in an academic center rather than in a community center, that would change the way that you would look at, I'm going to have to travel a little bit farther. That would make a difference to you. You could make a judgment call. And I think the way that we look at it is that we want patients to have all the information that they need, and then they can choose. We don't want to make the choices for them. We want to give them the data and let them make the choices. That's very empowering to patients, I think, to have data and be able to make their own choices.